Senator Bernie Sanders just cornered the CEO of Eli Lilly, the company that charges Americans up to $400 for insulin that costs $10 to make. Watch what happens when he demands answers. Drop your reaction in the comments below and hit subscribe so you never miss when Big Pharma gets put on the spot.
Do $6 billion, $7 billion stock buybacks. It doesn't sound like they're losing profitability. Mr. Hudson, at one point you said that, or somewhere had said that you felt that you guys were almost like the canaries in the mine shaft. Is that some reflection of the situation?
Well, what I have said publicly before is that when we used the same insulin as unbranded and reduced the price 60%, we wanted to see whether the system in all its form would pass that on the lower price to patients. And we recently reduced the price again, as you know, 78%. And we have some anxiety that it won't make its way to patients. In fact, patients may be taken off.
So you get the more you lower the price, the less patients you achieve. So that is the canary at a certain point.
Yeah, that's Chairman Sanders said that this committee may look again in a year to see whether it had impacted access affordability. I think that's the key question. When you bring the price down, remember our net price is $21, which is often less than the copay across all channels. $21 a vial for Lantus. That should change what is available and what patients pay. And if you come back in a year and nothing's changed, in fact less Lantus is being used, you have to say system's not working.
That's for sure. Mr. Ricks, let's ask all three of the pharmaceutical companies the same question. If you've all lowered your prices, do you think you will have gotten your products, your insulin, to more customers a year from now? Mr. Ricks?
Well, I think it was a risk to lower our prices, but one that we thought was worth taking. We were happy that competitors independently followed that, but we need to make sure that we can have our insulin stay on formularies and available. Hopefully, it would increase availability, but those decisions are in front of us.
Well, in front of them. What's your prediction a year from now when we all have a reunion?
Well, I hope that we'll have better access to low-priced insulin.
Okay, great. Mr. Hudson, what's your sense of that?
Yeah, look, I agree. I think, we spend a lot of time talking about insulin pricing. It's really a net price conversation. It's really what money makes it to make it more affordable for patients. If in a year's time more patients can get access to more affordable insulin, then it was worth doing. I really hope that's the case.
Right. And Mr. Jorgensen, I'm going to assume you're of the same mind.
Yes, I share the same concern. We don't know yet whether we will have access to the patients we have access to today. And I can add that our net price after rebates, fees and discounts today is lower than when we launched the products. So again, if patients are paying more and the price has gone down, something has not worked. Thank you.
Okay. Thank you. I'm out of time, but I think we can challenge the PBMs that are here represented, that if you guys are part of the fourth largest, the fifth largest, and the 12th largest companies in this country,
Senator Braun.
We can help resolve this issue.
Senator Braun.
Thank you, Mr. Chairman. I've been wrestling with this issue across the board for at least 15 years prior to coming here. Actually did something about it in my own company across the board too, to make things work for my own employees. That occurred in about 2008. And I was sick and tired of hearing how lucky we were through our insurance companies that it's only going up 5 to 10% per year. And Senator Paul earlier talked about free markets. He and I are going to be in agreement on that mostly, but let me tell you what free markets have in common, unless it's entangled with government like this business is, even more so than most industries. No barriers to entry, robust competition, full transparency, and here's probably the most important one, that the consumer, Senator Paul mentioned this, the consumer has no skin in the game the way it's currently constructed. They either want, when they need remediation, which is a very inelastic demand, when you get critically ill or have a bad accident, they want it done immediately, They don't want to shop around, and they either want their employer to pay for most of it or the government. It's a system by its nature that is about as far from free enterprise. It's more like an unregulated utility, and you're a part of it. The good news is, when I first started looking at it, hospitals were about 30% of the healthcare dollar. Practitioners were about 30 to 35%. Pharma was 15, insurance 15. Insurance and pharma have not changed a lot, even though insurance has become disproportionately more impactful in terms of keeping the whole system glued together the way it is. Sadly, hospitals have grown to almost 45% of the healthcare dollar simply because so many practitioners, that'd be like losing farmers in agriculture, aren't even wanting to get into the business like they used to. Used to be not only the Hippocratic Oath, but they wanted to have their own business to boot. They are increasingly being employed by large corporate hospitals that all play into this lack of what most markets have. So you pile all that up, you're to where Senator Sanders is. People are getting fed up with it. I got fed up with it 15 years ago. The rest of the world can buy drugs for 1/4 the price. They have health care as being 10 to 12% of their GDP, with every developed country having outcomes as good as, if not better. And here we are at 18% of our GDP, and it's going up as opposed to going the other way. Nothing works like that in a true market context. Maybe we'll not get there. Let's look at pharma itself. You've got a proprietary product that takes a long time, investment in R&D. Pointed out that a lot of these drugs have a $5 maybe material cost, yet sell for hundreds of dollars. So it means you've got very low variable costs, very high fixed costs. That's a classic case for how you can charge things and you don't have it related to your actual cost of doing business. Sounds like maybe on PBMs, if that is accurate, that you're working on a 4% profit margin. I assume that's on sales. I'm assuming you're getting a lot better return on equity than that, or you probably wouldn't be growing your businesses. Something's got to give. You're either going to get what Senator Sanders is proposing, where all other countries have done it, because they've never found a way to address the broad issues I've mentioned, and probably the easiest place that you could fix it would be maybe in primary health care, which never was insurance intended to cover scratches and dents. Never should consumers be in any market where they want someone else to pay 100% of it. Those that can afford it shouldn't even be under insurance for their primary health care. Those that can't should have that support. Otherwise, you never have a real market. I'm going to go to the thing that struck me most kind of significantly was when I heard Senator Sanders ask, why are you selling, especially, I'm sure it's simple molecule drugs as well as the biologics. Why is this stuff selling minimally for 1/4 of the price in most other markets that you sell to, and sometimes 1/10? Obviously, you're covering your variable costs. Why are we as Americans paying the bill, even though it is only 15% of our GDP? If it's not working here, how are we going to get the rest of the system to work? Why is that? I never was clear, and I didn't hear a clear answer other than you're going to continue to do it. You want to start, Mr. Ricks?
I can, yeah, thanks for the question. First, one problem with the data that is often cited is list prices in the US, where we get paid on net pricing after negotiation. Those numbers versus Europe are typically about 35% higher in the US than Europe, not double or some other number. So I'll admit they are higher on a net average basis. What do we get for that? We get the earliest access to new medicines of any country in the world. And in general, we have the industry here as well, which I think supports jobs and manufacturing roles, et cetera. So
you're breaking the bank. The thing you got to realize is all the things that you say are attributes of our system, they shouldn't cost us 50% more than what healthcare does across the world. And in your case, since most people have a prescription as maybe their first entry into the healthcare system, Here you're showing us where you're charging minimally 4 times as much here, if not 10 times. I don't think politically that is going to get you into the next generations of where you will be like a regulated utility, and it'll be the same format that all other countries have had to go to.
With all due respect, I think we get one other thing which I wanted to mention, which is the possibility of new cures and treatments. That is funded by more or less the premium we get in the developed world. They fund that for the world. And I think we have to strike a balance between having low-cost medicines today and future cures.
But what does that have to do with charging us 10 times to at least 4 times? I mean, why can't they carry? They're the ones not even doing the work. They should be paying more.
I mean, you raise a good point. Lilly will spend about what the entire country of Germany does on pharmaceutical research this year. So why are they not funding that? I don't know.
I think that's something you need to ask yourselves, or else I think the structure of what you're used to is not going to persist into the future because we simply can't afford it. You're in a business that has the peculiarity of uncertain outcomes, R&D. That is bona fide, but I think where you've defaulted maybe somewhere down the line, you say you don't need PBMs. We've had that conversation. Why wouldn't it then, why would you not need PBMs when they are making a smaller margin in such a complicated system and you're the producer of the product? In all other industries, you have a wholesaler that buys it, distributes it across the marketplace. And was that 7 minutes, Mr. Sanders?
That's 8 minutes.
Very good. I will yield the floor. We'll have the discussion further. Thank you.